Hi, everybody. So this is the final day of Cervical Cancer Awareness Month, and I'm absolutely delighted to introduce to you John Ryan. He's the Acting Deputy Director General for Health and the Director for Public Health at DG Sante. Welcome and thank you so much for being here today. Just to give you a brief synopsis, the CBIG Screen project aims to tackle inequalities and inequities in cervical cancer screening by developing this European-wide knowledge framework around barriers to screening. So we just wanted your thoughts really. What role do you think projects like CBIG Screen play in supporting the EU Beating Cancer project with improving the overall public health picture?
Thank you very much for inviting me to say a few words. First of all, congratulations to all the people who are involved in supporting this work in the CBIG Screen project. Some people may be aware that the European Union has adopted recommendations on cancer screening already some years ago in 2008. These cover cervical, breast and colorectal cancer screening. And as part of the implementation of those council recommendations adopted by the Council of Ministers, we have been implementing a whole series of initiatives, for example, in the area of quality assurance, in the area of training for oncologists to carry out screening on the ground, and also initiatives related to the rollout of screening to reluctant populations. And it's not only a question of vulnerable populations, I would say, but also people who don't want to be screened necessarily. This is particularly the case for men in certain types of screening for male cancers. There's a lot of reluctance to engage with the health systems and to have a preventative approach, you know. So this is why I think the focus which you've got in your project on the take-up of screening for vulnerable populations is really important. I mentioned that we have this long-standing agreed approach between the European Union member states. We're now in the process of reviewing this as part of the EU Beating Cancer plan. And I just wanted to say a word about that because I think it's important for you to know that the scientific revision of the cancer screening recommendations, which date back quite a long time, is now in its final stages. So we brought together a group of European scientists that are revising it. The Commission will then be proposing a new recommendation, which will be proposed probably at the beginning of next year. And this will lead into a whole series of new initiatives to relaunch the screening efforts. Yeah. And as part of the Europe Beating Cancer plan, the focus is really as well on not only on screening, but also on inequalities in health. Next week, during the Cancer Day, we'll be launching what we call the Inequalities Registry. And this is the second thing which I think is relevant for you, because the idea of the Inequalities Registry is really to pick up the differences that there are between different types of cancers, different populations, different regions in Europe, and to map all these as cleverly as we can, bringing together different data sets, and to use that as a mechanism to steer investment. So in other words, when we discover that there is a particular problem in terms of mortality and morbidity, these huge differences, for example, that we have in take-up of breast cancer screening. I know it's not the focus of this project, but you're talking about enormous differences in take-up of breast cancer screening. These are issues which we need somehow to address at the European Union level, so that we don't make the situation worse, so that we don't increase the gap. The whole focus of the cancer plan is to decrease the gap and to try and make cancer care, cancer prevention, access to treatments much more equal across Europe. Because for health, it's really unacceptable that you have these huge gaps between one country and another. I mean, you have an internal market, you have free movement of goods. Why would you have these huge mortality, morbidity differences between member states after so long? You know, So I think your project is really important in the sense that it puts the finger on vulnerable groups. And we'd be very happy to see you involved with the policy discussion we're having on cancer screening. And secondly, taking account of your experience with vulnerable groups, in other words, not just having something on paper, but something which would really include vulnerable groups. And secondly, if you could give us your experience on the inequalities registry, that would also be very helpful.
Great. Well, thanks so much for that. I mean, we'd be more than happy to facilitate any kind of cooperation that we could, and obviously very happy to participate in everything. Some very interesting information there and some very promising developments as well. So hopefully we'll be going towards somewhat of a brighter future anyway. I just want to say thank you so much for taking time out of your very busy schedule to share your thoughts. Like I said, very, very interesting and very promising. And we look forward to working together in the future. Thank you so much.